The chapter about first-degree lacerations will guide you on how to diagnose, anesthetize, and suture this kind of laceration. In this chapter, you can see the demonstrations of instruments and suture material, anesthetic using gel or infiltration. Suturing of the subcutaneous tissue is shown using a continuous technique. The suture is tied off in the introitus using an Aberdeen knot. We also demonstrate the method of inverted stitches for approximation of the subcutaneous tissue. The suturing of a second-degree laceration can be undertaken using various techniques. The aim is to re-establish the anatomy of the pelvic floor. The chapter is divided into three main sections: introduction, suturing techniques, and follow-up. You can learn about effective methods of applying local infiltration or a pudendal block. We will demonstrate two different suture techniques. This animation will show you the continuous method in accordance with evidence-based guidelines from the Royal College of Obstetrics and Gynecology. Suturing, using a mixed suturing technique which may be relevant in the case of complex lacerations. There is a follow-up section about the healing, recovery, and treatment of possible complications. The chapter about the suturing of a third-degree laceration is a demonstration of anal sphincter repair. The chapter is divided into three main sections: introduction, suturing techniques, and follow-up. The international classification of perineal lacerations is explained and demonstrated. The introduction will guide you on how to diagnose injuries to the anal sphincter. This is illustrated with both illustrations and by showing clinical footage. You can learn about the relevant instruments used and the Lone Star retractor, which can ensure a better overview of the wound area when repairing complex lacerations. In the section on suturing techniques, you can see animations and video demonstrations on how to repair the internal and external anal sphincter. You can also learn how to use Alice forceps for the identification of the torn muscle ends. The end-to-end and the overlap techniques are clearly shown with the use of medical animations. In the follow-up section, you learn about the normal healing process, recovery, the possible complications, and recommendations regarding subsequent birth. The chapter about the suturing of a fourth-degree laceration contains the following: the diagnosis of an injury to the anorectal mucosa. This is illustrated with both illustrations and by showing clinical footage. You can learn about two different methods of suturing. The continuous two-layer technique is shown as a medical animation. An interrupted method is also demonstrated using a medical model. There is no evidence as to which of these suturing techniques is preferable. It is therefore up to the individual to use the technique of their preference. Licenses are available for institutions and individuals.